The new thing in our ESPEN society is that we transform these scientific guidelines into what we call practical guidelines. And these practical guidelines are a little shorter than the original ones. And most importantly, they are transferred in a graphical way. That means flowcharts will present the content of these guidelines. As you can see here, we have the 5 chapters I just mentioned. And for each of the chapters, there is one or even more figures, namely flowcharts that explain the details of these chapters. And it also helps to go quickly through these guidelines. So it's also a very nice tool for navigation through the sometimes quite large guidelines. Yeah. For example, if we start now with chapter 1, which is indication and contraindication of home enteral nutrition, we come to this page where we see the indications and the contraindications for home enteral nutrition. So I think this guideline, and I come to the end now, gives a lot of valuable information, not only for the physician, but also for the nurses, for the dietitians, and for all the other professionals, caregivers involved in that quite complicated process. Here you see again the structure of this guideline with the 5 main chapters and a number of sub-chapters. Here you see the reference where you can look for the details.
Home enteral nutrition is a safe, cost-effective medical treatment used to prevent or correct disease-related malnutrition. The number of patients treated with home enteral nutrition for a multitude of different clinical conditions is steadily increasing. Home enteral nutrition is a complex procedure which implies a dedicated clinical and organizational setting. Home enteral nutrition represents an evolving field proposing new technical solutions while posing continuous challenges. The COVID-19 pandemic has confirmed the need of performing research and improving knowledge in the field of clinical nutrition. Home enteral nutrition production and delivery may contribute to achieve sustainable global development goals.
So some open questions are still open in intensive care unit because the number of studies is limited and we don't have definitive data and results about intermittent or bolus feeding. Guidelines until about 2 years ago were absolutely focusing on the role of pump feeding, but we have seen during the COVID period that when well performed and correctively followed by nurses with bundles, also in intensive care unit, we can use that type of nutrition with boluses. Probably additional randomized control studies are required, and this can be a very interesting topics for next studies. First of all, we have to develop skills in order to prescribe and use the safest and easier evidence-based method of enteral nutrition. We must know our patients, we must know our clinical status, we must know very well the type of enteral nutrition we are giving them, the type of tube we are using, the level of compliance, the level of assistance they have, both if they are in hospital or in home care settings. We can have different benefits with both methods. We don't have so far evidences of the benefits of bolus feeding versus other methods of enteral nutrition administration. Probably the future will be very interesting, mainly in home care settings, in nursing homes, we can imagine probably that in hospital settings, mainly in intensive care unit, the use of pumps will allow a more safe, secure, and personalized approach. But in all those mentioned settings, additional randomized control studies are needed in order to compare those different types of enteral feeding.